I don't think that anyone, any viewer for that matter, would deny that we are facing so many challenges in the UK. Inflation is creeping up to 10%. We have so many other economic challenges, real and potential strikes, because, amongst other things, the disparity in pay rises between the private and the public sectors, roughly 8% versus 3%, as well as the eye-watering scandals in the ship of state. A veritable cesspool of groping, lying, nepotism, narcissism, all pointing to a state of aimlessness. And more broadly, going beyond our shores, more broadly, we've got so many problems that actually catch my eye because they are happening in my so-called neighborhood. Sudan, where there is a violent repression against protests, in Tunisia, where the president is establishing a monocracy whereby he is the only master of the game. In Libya, a country swimming in oil is having so many problems both in the east and in the west. Palestine trying to find an answer to the murder of Shireen Abu Akleh and that famous bullet. Will the Americans lead to a fair investigation? And of course, Israel gearing up to new elections come 1st of November. All this is happening. But today, this Sunday, in early July, I'll put all this to one side and focus instead for just a few precious minutes on our own real life pathogens, the viral, not the human kind. And for that, I want to say that only this morning, I watched an interview with Jennifer Harris, a public health physician and a well-established, well-known, learned figure on our TV screens when it comes to public health issues. And she talked with the presenter about our real viral health-related issues. So let me focus on this for a few minutes, and let me just welcome you to Arm Wrestling with COVID in London. This is episode number 57. It's been a long time that I've spoken about this, partly because we seem to be living in a state of oblivion. We have decided that we do not need to worry about COVID, that we do not need to use face masks, that we do not need to isolate, that we do not need to be careful of closed environments, and that, you know what, the past 2 years have been an aberration, and now we can just get on with our lives. And of course, that means that we have shifted the argument, or at least the government has shifted the argument, from one of prevention to one of basically immunity, herd immunity. So, as I was watching Jennifer Harris this morning, I learned, for instance, that the BA.5 variant of COVID has shown a threefold increase in the last 2 weeks. Now, you would ask why? Well, we were hoping that in summer, usually the rates drop, and then we start worrying again in autumn when the COVID virus collides with the flu virus. But apparently, no, there has been a threefold increase in the UK and across parts of Europe, but let me focus on our own country. It has increased threefold in the 2 last weeks. Partly, I think, and I don't think that you would seriously, fiercely contest this statement. I think because of the huge gatherings. I mean, we started with Her Majesty's Jubilee Platinum Jubilee celebrations. You saw the numbers of people assembled together. Then, of course, we had, amongst other things, Glastonbury. We now have Wimbledon. All the tickets are sold. And of course, the Euro 2022, with UEFA revealing that a record 500,000 tickets have already been snapped up for this 26-day tournament. Can you imagine, all the Lionesses group stage games have been sold out, and tickets are no longer available for the Wembley final, where people are expecting 87,000 spectators on the 31st of July. Now, put all these people together. Can you imagine what would happen if the virus is lurking, is circulating? So what have we said? We've said herd immunity, okay? Let's deal with the COVID variant BA.4, BA.5 as flu. And anybody who gets it feels rough, feels awful for a few days, and then gets over it. Is that what we're doing? And then, of course, I don't want to go further and talk about the monkeypox cases. There are reported 1,259 cases to date. And people, Jennifer Harris also touched upon this, are talking of pre-exposure, post-exposure, and when should people be vaccinated against monkeypox. So, sitting here, and if you look at the record 56 previous episodes that I've done on this subject, you would realize that I am concerned. Why am I concerned? Perhaps a little bit more than the average Joe Blogs of this country. It's perhaps because of my own health issues that I've had in the past, which mean that my immunity is frail. It could be because of age. It could be because of thinking about what this means. And it could be because I'm separating economy from health, which has been the tug of war since day one when this COVID pandemic started. Do we lean on the side of economy, or do we lean on the side of public health and protection? On a personal level, I've known some dear friends in Manchester, in London, just across the road from me, abroad, in other countries, people who've been struggling with COVID only this week. So the question that comes to mind, the normal question that comes to mind, what should government do? And what should the JCVI, the Committee on Vaccination and Immunization, recommend now? You know, last week I was having a chat with my GP, a wonderful guy who is so busy and yet finds time for his patients, including yours truly. And I'm thankful for that. I was talking to my GP, and we were discussing the issue of COVID and the 3 jabs that a lot of people have had, jab number 1, jab number 2, and the booster. And I talked to him and I said, listen, in continental Europe, in places like France and Germany, people over the age of 60 are being given the 2nd booster, in other words, the 4th jab. Shouldn't we in the UK do the same thing instead of waiting until you're 75 and then giving you this 2nd booster or 4th jab? And I don't think that he disagreed with me. So my question today is, in the face of all the problems that we're facing, and I started political, economic, pay rises, people aren't able to put food on the table, people aren't able to balance their budgets, people are worried about transport, about strikes, about, I said, the moral deficit that exists in our political establishment. All that put to one side, we have an issue with this virus whether we agree to acknowledge that or not. And what I'm asking is not really the moon. I'm not saying we should go back to lockdowns. I'm not saying we should once again impose stringent measures, which I know the government and our Chancellor of the Exchequer, let alone our Prime Minister, would agree to. And the opposition is a little bit absent on this too. I'm not asking for any of those measures. All I'm saying is that the well-being of those 50 plus or 60 plus should be taken into consideration. These are people whose immunities are waning and who do not necessarily have the same stamina, the same resilience as those below the age of 50 or 60, who can actually stay at home, fight the virus, and get on with their lives. No wonder, as Jennifer Harris also mentioned today in her interview, no wonder that NHS hospitals are beginning to show an increase in admissions. Now, are we going to be, as usual, as this government has been on a whole host of issues, reactive rather than proactive? I mean, you're sitting at home, you're looking at what I'm saying, listening to what I'm saying, thinking at what I'm saying, and then saying, well, it doesn't apply to me. Fine, but it applies to a huge swathe of the population across our 4 nations. So shouldn't we at least consider their well-being? Public health policy, what does that mean? And the least we can do, and it is something that doesn't cost us much because we already have the vials of vaccine. It is something that we've done on 3 separate previous occasions, so we have the experience how to deal with it. The NHS does it wonderfully well. Why don't we say that anybody over the age of 50, or at the very least the age of 60, should have this second booster in order to prop up their immunity, so that even if they catch the virus, whether in those huge public gatherings, or when they're sitting in a conference room, or when they're going to the cinema, for instance, to watch, I don't know, Tom Cruise's latest blockbuster, that they will have a bit more immunity in them to fight off, to fend off this virus. Is it so inconceivable, so unreasonable, so illogical what I'm saying? I don't think so. And I'm not even trying to equate economy with health anymore. I've done this in the past, and I've shown how these two collide and how the government is unsure which way to go, hence the mixed messages. But all I'm saying is, think about this. It doesn't cost you that much in the middle of immense expenses and outlay, from all the money that we're pouring into Ukraine to all the money we're pouring into other aspects of life. Let us think of those human beings. Let us think of all those 50 above, 60 above, but no more, not 75 and above. Let's do what the continent is doing. We Brexited. Does it mean we sort of are regressing? And make sure that we at least show the goodwill and the good faith. And after all, remember, Virgil, one of Rome's greatest poets, reputedly said, the greatest wealth is health. Do we believe in that? Or, to put it differently, is there any reason why we should disbelieve that? I leave that to your contemplation on this sunny July Sunday. Be healthy, be well.